90 minutes after the hour of 6 on this Wednesday, and we're going to get into that discussion concerning mental health and the youth. And some might suggest and some might say, well, as young people, what them had to study, them have no bills to pay, and how them stressed out. But let me tell you, as a young person in this year time, believe you me, there are so many factors, so many moving parts, from the issues and the pressures of social media to what we are seeing happening with CXC results, generally the pandemic and the fact that they can't socialize the way they've grown accustomed to. So many different areas, and that's just tip of the iceberg. There are other factors involved there, but the good thing is there's help, and there are professionals coming in with workshops to ensure that young people are equipped to help their peers. And we want to get into that discussion because it's something called the Youth Mental Health First Aid Training. And to shed some light on that, we welcome Dr. Astril Webb, joins us on the Zoom line, to the top of the Zoom line. And of course, we have with us a young ambassador, Kurshelle Reyes, who I would imagine would have gone through some of the training. Welcome, ladies, and great to have you in the Morning Brew.
Good morning. Thank you so much for having us.
For sure.
Thank you so much for the opportunity to share.
Of course. And Dr. Webb, I want to start with you because you are the president of the Healthy Kinda International. And the reality is there are those who don't see a correlation between mental health issues and young people. And that's why I did the introduction. I was very intentional with that intro. And I was trying to suggest here that we can't think that way. We have to move away from that mindset. Young people, just like anyone else, they have things to deal with, and it can impact their mental stability and mental health.
Absolutely. And I think it's important for us to recognize that amidst this pandemic, if we didn't recognize it before, we definitely are seeing it now. Our young people are struggling socially, emotionally, academically, as you said. For most youth, social development is key, especially at this age, and they're not able to do it. In the pandemic, they have seen a significant amount of death, loss, dying, and it is scary for a young person. And what we're seeing in the data is that suicide is now climbing the scale in terms of one of the leading causes of death in our youth. And so we have to act now. We can no longer wait. Statistically, we're seeing that every 8 minutes, a young person is contemplating suicide. And every 8 hours, there's an attempt made. And so we've seen this is the crisis mode of mental health issues. And it is really driven because of a dark place of depression or this feeling of hopelessness or helplessness. And that is why it's extremely important for us to be able to recognize the warning signs and symptoms of a young person struggling with mental health, which is why the Youth Mental Health First Aid Program is extremely important right now. It's actually the only evidence-based program that we use from a non-clinical perspective to teach about youth mental health, what it is not, and really to get us to break down these walls of stigma and discrimination around the words mental health. Just as we focus on physical health, we have to ensure that we also have good mental well-being.
Let me bring Kurshelle into the discussion, Dr. Webb, and find out from Kurshelle, because you went through the training. What did the training entail, and what was your takeaway, and how have you been able to use that particular skill set now to help fellow young people?
Yes, good morning.
Good morning.
Again, thank you for having me. For me, the training was very, very instrumental in my development of my mental health in the first place, you know. And as a young person, I realized how important it is to get the awareness out there, you know, and to make it less taboo. And so I've learned so much about, you know, why things like bipolar is missed, you know, certain mental health, why it is misdiagnosed and things like that, how to look for signs of mental health within the young, generation and things like that. And it's so sad to see, even in training, that there are certain websites and things like that that promoting, things like taking your life and things like that. And I wasn't privy to that information before the training. And, it opened my perspective so much more to see how much we could help people and how much we need to help these young people. So, in a nutshell, the training did a lot for me, my awareness, my knowledge, everything. Yeah, so I'm really grateful for that.
Kurshelle, you think you got the tools now, the foresight to see the red flags, and more so if you see the red flags, you can now step towards a fellow youth like yourself and probably just render some assistance?
Most definitely, I am more confident, actually, now that I've been trained, and so I look for things like that, and so I practice things with conversations with my peers that I have lived, and so I'm also, I now know the resources that I can direct them to, and so definitely.
Wow, Dr. Webb, it's so amazing what you're doing, because you have just empowered Kurshelle and well, from what I understand, 17 other young people, 18 would have come through the first training session. I'm sure you're looking forward to empower more. What's your catchment group in terms of age when we consider youth? I know there are various classifications of youth, but in this program, what do you consider that youth bracket really impacted?
Standard for youth mental health first aid is ages 12 to 18.
12 to 18.
However, I have seen that the information has been applicable from ages 8 through 26. So that's your university college age group.
Okay.
And so when we provide the training, we really capture elementary or primary school all the way through tertiary or university level students, because so many of them have unresolved issues from their younger years. So it's extremely important that we catch it before all of the issues of adulthood hit them. Yeah. The earlier the intervention, the better the overall outcome is for that individual.
Indeed.
And hence the reason.
Yeah, and I could only imagine from, especially with young people, if they're going through a scenario, seeing their parents, let's say, at odds, probably issues in an area where they're seeing things or exposed to things way beyond their years. Yeah. The social media issue, I think that's a major talking point also, because I could only imagine the pressures. Kurshelle, I guess, could also relate to that. And Dr. Webb, I want you to elaborate first. How much pressure does social media and so much, well, more so the comments, when people go into your comments or slide into your DM and put forward stuff that might be harsh, how can that impact the mental health of the young people?
Well, we know that probably the greatest driver for self-depression for most young people across the globe right now is cyberbullying. It is the negative feedback that they're seeing on their social media platforms. And this is a desire, again, for this young person to want to belong somewhere, to find this niche, this group, especially amongst their peers, as they are, social development is probably the most important phase of their life at this age, during these years. And so they are looking for how many likes, how many positive comments, but the truth is most people are very negative and will say many ugly things to these young people. And so it is extremely important for us to recognize, because of the link to the social development, it is going to happen. How do we overcome it? We have to empower young people, build their self-esteem. We need to start speaking to them more. All right, they need to understand we love them unconditionally the way they are. People make mistakes. Young people would make bad choices. This is all a part of development, right? But with time, they will learn how to make better choices if they know their village is available. We have to bring the village back. And so in social media, if we don't bring it back, they're going to look at social media for their village. And unfortunately, the negative impact of these words really traumatize some of these young people. They play the messages over and over in their heads as though it's a tape recorder, because they believe it. And so we have to learn how to speak more, verbally and non-verbally to our young people so they don't depend on social media.
Thank you, Dr. Webb. I want to ask Kurshelle, before we wrap things up, how have you been able to navigate the social media space, especially when people would have come at you in a less than complimentary manner, slide in and say some kind of comment that really got under your skin? What was your coping mechanism there?
That's an interesting question, because for me, I had a hard time dealing for a moment with social media and, getting accepted, as Dr. Webb mentioned. But for me, it took time to love myself, and develop that self-assurance, to say that I'm good enough regardless of what social media said. Yeah, and so it took, that journey there, just getting to develop that confidence within myself.
Yeah.
And I said, so despite what social media says, I know what I believe and I know who I am. So that's the answer.
And that's the most important thing. Kurshelle, I want to thank you for that honesty, Dr. Webb. Before we wrap, we're going to lock things off at this point. But if people want to contact you, continue the conversation, reach out to you, how can they probably get you on the said social media or even an email address?
Right. So, we are on social media, Healthy Kinder. However, we are really promoting the Youth Mental Health First Aid program through our partnership with Future Focus International. So if anyone is interested in that program, I really want you to reach out to them at futurefocusemi.org, or you can email them at info@futurefocusemi.org.
Dr. Webb, I want to thank you so much, Kurshelle. I appreciate the honesty, and kudos to you and the team and all involved with this truly tremendous initiative. Thank you so much for coming on, and well done with the matching royal blue ladies. Clearly, you all coordinated. Look at them. All the best.
Thank you so much.
For sure. Oh, in their royal blue on this Wednesday. We're going to come back and talk about diabetes care and get into that very important conversation. Stick around. It's your Morning Brew.